So people often ask what happens when they come for an appointment for a gynecology problem. What does a gynecology problem mean? Gynecology is the non-pregnant aspects of women's health. So we might see people for heavy periods, older women maybe for a prolapse of the womb. We might see people for advice on contraception. We have a menopause clinic which is run by two of my nurses and myself, or it might be a fertility clinic. So what I say to people is that most gynecology appointments last about 30 minutes, and where at all possible we try and get the maximum amount of testing and information and scans done at one visit so that people aren't coming back and back, because obviously it's important now with COVID that people aren't having to come to lots of visits, but equally people are trying not to be taking time off work. It's also worth mentioning that when we see the referral letters coming in, we try and figure out, do you actually need to physically come to the clinic for the first visit? Because we now have software that allows us to do history taking on the phone. We now have facilities to do finger prick blood tests for certain blood tests. So we do kind of tailor the appointment to suit people. So when people come for their appointment, they will have a detailed history taken first, and then we decide on what extra tests need to be done. Almost everybody will have a gynae examination, and almost everybody nowadays has a vaginal scan, an ultrasound scan. Scanning has become almost an inevitable part of gynecology because it allows us to look inside the womb. It allows us to see the womb, the ovaries, and now that 3D is important in gynecology, it's almost like a little mini MRI scan, and you get your results of an ultrasound there and then, which allows us to plan things. Sometimes we might need to do a little biopsy of the lining of the womb, and nowadays that can often be done in an outpatient environment as well. Sometimes we need to do a biopsy of the skin down in the vulval area, and that can usually be done as an outpatient as well. Swabs, etc. can be taken as an outpatient. So more and more gynecology is becoming an outpatient based specialty, and people are really only going to hospital when they're having a major surgery like a hysterectomy or a pelvic floor repair. So a lot of the time what we do all in one visit. For heavy periods, the treatment then may be using the Mirena for managing their heavy periods. Very rarely nowadays is a hysterectomy of major treatment for something like periods. There are so many other options in between along the way. We refer on to physiotherapy a lot of the time as well for women's health problems such as prolapse, bladder issues and vulval pain. And for fertility, we do most of the investigations here. And if someone needs a more high-powered treatment such as IVF or other forms of assisted conception, they're referred out to one of our clinics that we are liaising with. From the point of view of menopause, most of the time we will make a decision at the first visit what we think the treatment plan should be, and people have time to think about it. We have a lot of information packages that we can give people online, Dropbox, USB sticks, so that they can go away and have a little think about their treatment options before they come back to us. Or we can do the second consultation after they've done all of that. We can do that consultation online. So that's what a gynae examination involves, and it isn't something that people should be fearful of. And we have a team of staff that are very experienced in this area. So we get most of our patients referred by GPs. From time to time, people self-refer because it might be a problem they're not able to discuss with their GP or uncomfortable with. We like to get a little summary before you come so we know what we're going to have to deal with. And we can put a longer appointment aside if we think it'll be something complicated. So gynecology nowadays has become a really, really important part of healthcare. Women are looking after their health. We know that the life expectancy of most women nowadays will be probably well into their 80s and 90s. So people need to look after their health, and we are there to try and see what care we can provide locally for you.